Welcome to Facts TV News, where everything is true.
Remain at home and monitor mild flu-like symptoms, CMO cautions. Chief Medical Officer CMO, Dr. Jacqueline Bisosa Mackenzie, is advising the public to remain at home and monitor themselves if they develop mild flu-like symptoms. If symptoms worsen or persist beyond 3 days, or you have chronic illnesses, then you should seek medical advice. This can be from your private practitioner, from the health center, or from the parish health department, she advised in a public service announcement. She noted that people may be advised to do a coronavirus test, which can be done privately or in the public health system by referral. A list of public health testing sites is available on the Ministry of Health and Wellness website. Persons with severe symptoms should seek immediate medical attention, she said. Dr. Bisosa Mackenzie advised against people to continue to observe the infection prevention and control measures. All persons are encouraged to frequently wash their hands, wear a mask, and get vaccinated. If you are due a booster, take the booster, observe physical distancing, avoid crowded spaces, stay hydrated, exercise regularity, and eat healthy so that you can protect yourself and fight against COVID-19, she said. Bornberg renews call for COVID-19 testing in schools. With face-to-face school now in its second week, opposition spokesperson on education and training, Dr. Angela Bornberg, is calling on the government to put plans in place for COVID-19 testing in schools. In many other jurisdictions, an important element in ensuring that our students and teachers are safe in screening and testing. The last time we spoke about testing in schools, the government said that they had no plan, said Bornberg during the media briefing stage by the opposition People's National Party on Tuesday. She argued that school nurses are concerned about the frequency with which some parents are sending unwell children to school, but noted that the opposition recognized the difficulty faced by working parents in this regard. According to Bornberg, there is an urgent need to figure out how to balance the concerns of education and health in Jamaican schools in the era of COVID-19 and at a time when the country is nowhere near the aim for 65% vaccination rate for students. As you can imagine, many parents and teachers are concerned about how the government is going to ensure that our children are educated while providing a safe environment for everyone. Because we have no vaccines for the majority of our students, testing is going to be important, and that, I believe, is non-negotiable, declared Bornberg. She added, we need to ensure that everything is put in place to ensure the safety of our children, early detection, and that other protocols can be put in place so we do not have to reach a situation where the ministry has to go back to close the schools. Bornberg told the media briefing that the current face-to-face modality for schools that was rolled out on January 7 is greatly supported by the opposition, given the issues of low internet penetration in some communities and schools, the lack of access to devices by some students, and the absence of home-based support in some cases. But she argued that the government has not been clear about the statistics concerning this. To date, the government has not been able to give a proper report on exactly where we are and also who are the students and how many of them are without devices. We have also not heard a comprehensive plan about how we can cover the critical percentage of students who need devices, charged Bornberg. University Hospital under pressure from COVID patients. A number of patients in need of oxygen and medical attention at the University Hospital of the West Indies, UHWI in St. Andrew, Wednesday received care either in a driveway, a corridor, or under a tent in front of the Accident and Emergency Department due to a shortage of beds and space, resulting from an influx of patients with COVID-19 symptoms. Chief Medical Officer Dr. Jacqueline Bisosa Mackenzie has reported that bed capacity at most major hospitals across the island have reached 90%. Chief Executive Officer of UHWI Kevin Allen reported that the operations at the institutions were becoming difficult as the fourth wave of the virus shapes up to wreak havoc. He reported that the system is further strained as roughly 90 nurses are at home sick. For patients and staff, Allen said the situation is stressful, frustrating, and difficult. He encouraged staff to hold it because the worst is yet to come. We are putting systems in place and we are working to see how best we can ensure we hold it We are not in the breakdown days yet, but it is rough, he said. The last report I have seen, we have some 90 nurses out of the system, and that is crippling our operations. We have roughly 880 nurses, and about 10% have come down with the virus, Allen added. We were already operating short with these skill sets, so to lose so many with impact on the quality of care. All the areas that we operate are full. The field hospitals are full, isolation is full, emergency is full with patients. We have to revert to using tents. Allen said that on Tuesday night, the hospital had 26 patients who were being cared for on the outside. It is not just about the shortage, but it is also about the numbers of patients turning up with COVID-19 related symptoms that we have to deal with, he said. One man who was visiting his 84-year-old father in the field hospital was livid about him allegedly being tied to a bed and neglected since being admitted there on Saturday. He said that the elderly man was taken to the hospital after collapsing in Papine, St. Andrew. He claimed that his father has been given food on Tuesday night and received nothing more to eat or drink up to Wednesday afternoon. And we have to carry something for him eat. When him see we him say, Lord God, beg you some water please. And them thing ya go on. Them not treat them right. Them not get no form of good treatment. Them all time up because them say him a try go away. But the situation when him in here so, you a go one go away. Medical Association of Jamaica President Dr. Brian James, in an interview last Wednesday, recommended that the government tighten curfew measures to limit spread of the virus during the fourth wave. He also said that face-to-face schooling should be put off for at least a month. We have been suggesting that the restrictions may be a bit too liberal and we should consider going back to a very minimum at 8 p.m. curfew, he said. In a statement Wednesday, the Minister of Health and Wellness said people who develop flu-like symptoms should remain at home and monitor themselves while also observing infection prevention and control measures. Mandeville's COVID wards exceed capacity. Chief Executive Officer at the Mandeville Regional Hospital, Alwyn Miller, says the experience of 3 waves of the novel corona pandemic has put the facility in a better position to cope with the ongoing 4th wave. At this point in time, we are managing fairly well, he told reporters on Wednesday. Miller said this was the case although the facility's 2 COVID-19 wards with 18 beds are now well in excess of capacity with 35 positive and 10 suspected cases. The situation had begun more challenging because 35 members of staff are in quarantine after contracting the virus or are showing symptoms, Miller said. However, he told reporters that the situation has not so far reached crisis proportions because of contingency measures, including proactive preparation to retrofit additional spaces to accommodate COVID-19 patients. I wouldn't say it is severe at this point in time. If the numbers continue to grow, both with patients and staff, then there would be a concern, he said. I am hoping that the numbers in terms of staff in quarantine will not grow much more and we will be able to have almost the full complement here at any point in time to help us to deliver care, he added. He said that in comparison to a few months ago during the 3rd wave, the number of COVID-19 patients at the Mandeville Regional Hospital is relatively low. We have the experience of the last 3 waves, which puts us in a better position in terms of treating such patients. In the 3rd wave, we had a high as almost 150 such patients in the hospital, so thankfully, we are not at that level now, he said. Miller said that once COVID-19 bed capacity of 18 was exceeded, the hospital was forced to find ways and means to accommodate the additional demand. It was recognized by the hospital's management that in some cases, some services would have to be displaced somewhat. At this point in time, we are at that stage, he said. He explained that he and fellow managers are close to monitoring the need for any additional space for COVID-19 patients and would make any requirement adjustments as needed. The area we're looking at accommodating any additional COVID-19 patients will be the male and female medical wards. It means that for our non-COVID patients, we'll have to shift to another space, and that will potentially be the outpatient department, he said. The functions of the outpatient department were relocated to the Mandeville Seventh-day Adventist SDA Church last September, which is about 100 meters north of the hospital across Caledonia Road. Miller thanked the SDA Church for agreeing to expand the use of its grounds. We did not meet that request from December in preparation for the 4th wave, because we felt that it was coming. We have dialogue with the church, and we're thankful that they have agreed to extend our lease agreement to utilize the church for the outpatient department, he said. It is not one where they are charging us any rental or lease actually. The only thing that we are paying for is for the light, he added. He is encouraging people who said they have become fatigued over COVID-19 not to underestimate the impact of the Omicron variant. There is still no room for people to be complacent and not follow medical advice as it relates to the protocols and vaccination, he said. PAHO highlights vaccination to fight COVID-19 variants. Pan American Health Organization PAHO Director Dr. Carissa Isdini says vaccine is especially important in countering the Omicron variant of the novel coronavirus, COVID-19, as the strain takes hold in the region. Speaking during PAHO's weekly digital COVID-19 media briefing on Wednesday, Dr. Carissa said, while the Delta variant still sparks new infections in the Americas, based on current trend, Omicron is on track to become the dominant strain. Data from PAHO shows that over the past week, new COVID-19 infections almost doubled across the region, rising from 3.4 million on January 1 to 6.1 million on January 8. Dr. Carissa noted that the spike represents a 250% year-on-year increase when compared to the 2.4 million cases reported during the week ending January 8, 2021. The director informed that 42 countries and territories in North, Central, and South America and the Caribbean have already detected the Omicron variant. Some countries are already experiencing widespread community transmission, and Omicron spreads more quickly than other detected variants and more likely via airborne transmission in closed spaces, she further advised. Dr. Carissa cautioned that this new wave of infections won't be mild for regional health systems, noting that the Omicron variant is already challenging our health workforce and limiting care for other diseases. In small island states, some hospitals were already strained by cases of the Delta variant, and now more hospitals face the prospect of being overwhelmed with cases, she further stated. The director pointed out that one of the characteristics setting Omicron apart from its seemingly less severe symptoms. Even so, Omicron infections can be lethal, especially for the immunocompromised and the unvaccinated. So the time to act is now. Using the many tools we have now at hand, Dr. Carissa emphasized, citing vaccines among these. She said that countries across Americas have been working diligently to secure the vaccines they need to protect their populations. Thanks to their efforts, nearly 60% of people in Latin America and the Caribbean have been fully vaccinated with 2 doses, the director added, while pointing out that countries such as Chile, Cuba, and Argentina have some of the highest vaccination coverage rates in the world. Noting that vaccines are helping to save lives, Dr. Carissa said expanding equitable coverage remains PAHO's priority. The World Health Organization Strategic Advisory Group of Experts, SAGE, has also called for vaccination strategies to be optimized for prevention of severe disease, including the targeted use of booster vaccination, she added.
Please remember to subscribe, like, share, and click the notification bell for daily updates.